was first attracted to the program because I was introduced to one of the products. A friend of my wife's, Sandra, introduced us to a product called OPC3. And your listeners may not be familiar with OPC3, and I certainly hadn't heard of it before. So when I heard of this product, I was somewhat skeptical, quite frankly. But I had a son who had some issues with his breathing. He was really slowed down by them. He was on inhalers, a number of pharmaceutical medications, and we noticed that on the pharmaceuticals, he was a really smart kid. He still is a very smart kid, but he was slowed down by them. You could really tell that he had a kind of a negative effect from some of those medications. He was trying to play Little League, and there was a lot of dust on the field, and you could just hear him out there coughing. He'd have to pull out an inhaler as he tried to play baseball. And, you know, my wife started him on the products, and he noticed a dramatic improvement in his health, and really in supporting his pulmonary health and normalizing his pulmonary inflammation. And quite frankly, he didn't have to take any pharmaceuticals because it supported his health. And I saw that, and it sort of at least opened my mind to the possibility that there could be products that support your health. So at the insistence of my wife, I started taking the same product, OPC3. And it turns out I was having some health issues and health challenges of my own. I was having some knee pain and some blood pressure issues. And both of these, I really felt better on the products, and there was some objective improvement in my symptoms and in my overall health. And again, I hadn't heard of these products while at Harvard Med School or while I was at Walter Reed in the military or during my total joint fellowship. So I had to do some exploration. It really, I felt obligated to try to learn more about this. And fortunately, as you mentioned, there are CME courses, AMA, PRA Category 1 courses that healthcare professionals can attend. So I went to one of these courses, and I felt I learned a lot, and it gave me a scientific basis for why these products support health and normalize physiologic symptoms. You know, really it's all about, to me, making my patients feel better in whatever way I can to improve their health, to normalize their function, and to really make them happier as a whole. And so I continue to use these products in my practice. It's really interesting because it's come around full circle for me. My son, who had these respiratory issues, now is on no pharmaceutical meds. His mental clarity came back. He's a sophomore at Harvard right now, and he's a sprinter on the track team.
Wow.
I have the products in my practice, and now I find myself teaching those same CME courses, which I attended. And, of course, I take the products on a daily basis myself.